aye ensunsun sanso a de beba ne faso betumi nya firi so no ho komo ene be bedi ne na no pe na ene ye ne W.H.O or ye principal regulatory officer safety monitoring and department food and drugs authority ene ye ne bedi komo afasa ensemu na ye daseda ma aiming scientific herbal and alternative medical hospital a wo afasa segment ho eka apomde won sema ye kan no aya na ye anka kobia nanka ono awate no hospital a o premfa so no anka o mudwa sika mfanto ne mfa mo apomde hu dawuru se ne be bebo ye ho ban anka onye sa na so Dr. Sheikh Amembo nso one na pamfa dwene ho ahu se da bi prevention is better than cure even though our hospital no or discover beto airtime no na what they ama so nipa ni fini hospital ho so free here o nipa bia nim de owo bia no won fa mebo ya pom de ho nsemsem enti sa woda na bo mpa ya no abobi e de ama aiming scientific herbal and alternative medical hospital beni oda no Dr. Sheikh Amembo nso se wo dwene Ghana fo ho sa na ne nkorabata no edoso hospitals no ye bebre Ghana ha nyina hyeta bebia na se de beye na so betu anya yaresa edimunti no mebobɔ mo number ne de ama na wo nso watwere de ato na hododo a ko aiming won be ye text bi esa wo ye bia diagnosis bi esa wo ye bia won be diagnose wo atumi ahwe bebia yare ne hyempempe so aduro enti won de nro no so kan wo kwan bia so won beto ama na abro so kora test bi o esa kwan na South Africa US Germany Spain ne me ahodo bi aiming scientific herbal development okofa fide ni nyina bi de abaga na ha ye ni nyina o Ghana ha ya enti from 020-722-9505 020-722-9505 and na 0244-227-192 0244-227-192 and na the krakra 0245-275-254 0245-275-254 na woni omu ni nkomo na bibia wo no wo mo atumi aba behwa ma ho atumi ato Auntie Adela Ashi, good morning.
Good morning.
Udinam se minyani ye?
Adelashi.
Adelashi. I see. Na malaria nroyi aba World Health Organization for so approve malaria no. Mo na mo Food and Drugs Authority dey ebe no se ebe no se ebe di se ebe den efiri ho. So dey na betuma ka fa sa new malaria adru ya be.
Okay, that's it. Now, me, good morning. Now, most introducing Food and Drugs Authority. Here na abandoned tumnation said endure needs but now be do Ghana and yen safe, efficacious of good quality, safe chade say enwe druna enyon sons bonibia. Na why the year so good quality. And efficacious chade say ye baby yawa na say use a druna or there to moto also yerba. Na malaria vaccine ye kan ho asemi a W.H.O last week or recommended for broader use no. Say kaya 2019 na start the malaria vaccine a pilot implementation no.
Yeah.
Or from RTSS. Na malaria vaccine wa ba there obaka other malaria prevention interventions ho. No wa bo Ghana for yan ho ban against malaria. Yeah, imda malaria of course a whole baby. Of baby want to cause because we malaria. Actually 2019 Ghana about 20,000 children under 5 were we from malaria. So chade now what has happened in the malaria control program were interventions including sleeping at the mosquito nets on your prevention spraying or indoor residual spraying ni na prevent malaria. But on top of all these, no vaccines, yeah, the autumn bonipan hoban. About 30 years ago, no started them development of this malaria vaccine around 1984 thereabout. No one discovered that they have this malaria vaccine now. What to wabo nipan hoban say ewa malaria pass and tuntum no kawa na malaria pass wako mojenima wontum wako liver anima wontum won reproduce won wo bebre na won ho na malaria no. Into test was started until GSK company no way them vaccine in 2015 and when you what we call positive approval from European Union agency in EMA. Now EMA no what they do is that once no way today regulatory authority for drugs in the whole of European Union. Into what they did was that by giving the positive opinion or share the malaria vaccine won Europe, but we review based on all their stringent criteria who they do know ye. And based on that, in 2016, W.H.O said, okay, you do know the vaccine, do no ye. Into yen share say use for real life obesity no why into they do what we call a call for countries to come and take part in getting more data on this malaria vaccine. Into Ghana yakwe other countries here Kenya and Malawi and one away what we call the malaria pilot vaccine implementation. Now what it is that in clinical trials now they realize that malaria vaccine what will prevent about 30% of severe malaria. Say, if you have malaria, no hospital, no, or severe into woman moja, but we reduce them by 3. Until we realize they are positive or helpful. Now, over select countries, they use different factors. One of them was a strong malaria control program, a strong immunization program. And a very important thing here, there, say, if there are any safety concerns, there's an authority in the country that can assess and make an informed decision, which is Food and Drugs Authority. Into Ghana apply near winning to 2019. Next time what we call the malaria vaccine pilot implementation program. Our year were 6 regions in Ghana. Now what we were doing was that they were giving the vaccines to children and under a certain age for a period of time to find out the positive feedback no when your clinical trials will it be maintained in real life. And since then, that's what they've been doing. National malaria vaccine, there are 4 doses or there were at 6, 7, 9, and 24 months. And one of the key things with the pilot implementation was that is it feasible to give all those 4 doses? And what is the impact? What will reduce malaria cases? What will reduce deaths from malaria? Also, what checking. And there were some safety concerns too that they wanted to confirm that is it really there? Until and since last year, different expert committees under the W.H.O in Africa and also in Africa will assess the data from all the studies that are ongoing to find out whether we can roll out the malaria vaccine wider, because if its benefit is more, we should do that. It's supposed to end in 2023, but there was a timeline that after 24 months of reviewing the data, what should I say? Benefit of the vaccine here very bigger. Want to the year now to 2023 and Sana Yama other African countries and other more in Africa will benefit from the benefits from the malaria vaccine. Into why them discussion where do they see indeed all the benefits they saw in the clinical trial are there. Into malaria vaccine they introduce it can reduce about 30% of severe malaria, which means that in the long run, because severe malaria, which reduce death, your blood transfusion to reduce all that, you have more children growing more healthy, not missing schools, and having a more promising adult life.
May I family Yamagana Muha? FDA for and she share Ben and Moya for Sadruno, says a Muaja to say, ye. I say near Beshas say, Maja to my Breben, and Monagana Health Service for bidding our so much as I say. Mobile one said the walk of the DB and I say I just say mobile day.
Okay, me that say. Now malaria vaccine introduction when as part of child immunization program. On that we are now okakaji polio, okakaji measles. Into what should they able to use for Ghana the same way now we're implementing. Now MDNU we set up an expert committee. That's the Joint Malaria Vaccine Committee. We'll review here safety data now. And once we review okada in so one bia or should be any malaria vaccine no home. Now since last week WHO expert committee now so meet no Ghana here technical working group for the malaria vaccine also be meet. We decide the CCR no vaccine or bobo how we implement it in Ghana. Now it's a stepwise approach. On your Ghana could be decide that we are going to use it. It's a lot of stakeholders come into play because most of the vaccines all the from it is funded by UNICEF and W.H.O and then the government of Ghana also pays some of it. As I now know, once the approval has come, manufacturer now or a vaccine, I felt over discussions with the manufacturer to know how they will scale up to make sure that the needed doses of the vaccine is available. That's the first step. Now, most of the vaccines, so WHO and UNICEF, no other vaccines never. And what's going to happen is that there's an organization, Gavi Alliance, one of most of the vaccines will check out.
Okay.
And WHO is going to have discussions with them to see what is the financial benefits and now feasibility of making these vaccines on a large scale to make available to more children in the sub-Saharan Africa to protect them from the malaria.
Okay.
It is a stepwise decision. I feel we will meet and then they'll do that. But malaria, WHO says what they are doing, that they are drafting guidelines on how to implement it, how to go about it stepwise. We are waiting for those guidelines. Based on that, our technical working will also meet and then discuss how they're also going to do the implementation before they roll up. But as of now, the pilot implementation will go on to 2023, and then there'll be gradual expansion to other regions. Some there are only 6 regions doing that. Other regions will also be enrolled on until it becomes part of the malaria control policy, which will be done by between under your vaccine into EPI Norway. Usually it's a malaria thing, a malaria control program also. These two public health programs have to come together and discuss how best to roll it out and implement it in Ghana.
Now, you share do some way can Ghana, yes, you play Ruby, you be mu.
Yes. Good. In Ghana, no, we were part of the clinical trials, the phase 3 clinical trials in 2009. Researchers in Ghana were Kintampona and Navrongo were part of the clinical trials to test the vaccine at that time. And then apart from that, no, Ghana was part of the AVRF committee were reviewing the malaria vaccine to say that indeed we can pilot it in Ghana. And that was with Ghana, Malawi and Kenya. So Ghana experts were part of what we call the joint review of the protocol to say that it can be undertaken in Ghana. And since 2009, so Ghana has also been taking part in the pilot implementation. Bono, East, Ahafo, Volta, Oti, and Central region. These are some of the regions that are taking part in the implementation. And all of this are giving the vaccine under routine use. And now, say, we are African sons, Bonibia, Obaka, now our report, I'm an FDA. Now, here, FDA, expert committee, I'm mentioning, no. They will also review the data and find out is there any safety concern. And now, so when we watch the age vaccine, a vaccine all of and we review the now, okay, this is good. And based on that, you know, FDA approved the vaccine in the first place. That was in 2019 for us to pilot it. And then we had the expert committee to monitor the safety since then. And so we're also part of what we call the Data Safety Monitoring Board of WHO. We go and review all the data from all the 3 countries that are taking part in the pilot implementation. So we're hands-on right from the clinical trials to the review of the protocol for the pilot implementation, and throughout this pilot implementation, rigorously evaluating all the safety data to come to that conclusion. And see if the technical working group agree that they are going to implement it, they will give it a proper marketing authorization for it to be used in Ghana.
Fancy or cannot say in a big room. No, why now preparation most my area, and then we do it, then later on we postpone and but I can't find some of my yes, yeah, Sadria be Ghana for so many also.
Oh, Ghana be for so be because vaccines obo from who obo nipan ho ban since COVID-19 vaccines anu me kakaka yet you go back to normal. Inti malaria ni ehwe no oku mofoma bebre meka dey in 2019 alone 20,000 children died from malaria. We feel malaria. Mofoma ho ye sure wontu nko school che dey wontu nsuade exams by one pass. Inti benefit to Ghana nye dey say ye tum yenya vaccine ye roll out the vaccine by hand childhood immunization program that Afrobaby obo won bia within in fear na age no what you vaccine na what watch the Ghana no you bring more healthy children. You be reduce malaria and now you be the malaria deaths and now malaria case one be malaria no obo reduce and now obo befom say bia sanyipa 100 be malaria na nyipa 30 wonya malaria no. Now, on the malaria vaccine, so on its own. Another study where you share there, baby, we use malaria vaccine. We don't confuse water and the mosquito netting. And to check there's added benefit. Into the benefit from the now benefits.
Fasoli benya.
Fasoli benya from sorry, fasoli benya fee over the mosquito net no no. Obaka fasoli benya fee malaria vaccine no. Ntobobom. And say be malaria vaccine no reduce nipa train no wonya malaria because of vaccine na say be mosquito net no so edema ebaka wo kire more anakofo bebre na nkasa na won kanya malaria no. Wonya pa only serious malaria. Wotum 3 days WhatsApp with oral endura one and maybe 100 baby na one WhatsApp into malaria vaccine oboboa hen na yenyu agide it has got a positive feedback that is beneficial.
Yeah, share in some abani say anamfo na pani ababa won kwala pani ababa bon kwada hu ni na bibi say si.
Oh, bibi sa insi because extra as part of implementation we share there awofo na healthcare professionals, how do they see the vaccine? One who vaccine then now what be say efie na wo mofo call vaccine no when there when you have the vaccine because when we there one ba no 1 year malaria be break the most affects no when malaria no nti awofo no what you do from the studies away from inhwehwemo in baby na what wardrobe no who there awofo no what you vaccine to nti on the onya the vaccine why your baby no odaba so most America no Ghana clinical trials no yeah time what you should do in the first place no you take it part you can say review document no and say yeah that to the pilot implementation in Ghana yes study pilot implementation yan so that yan kada ye twena mbrofo wa hwehwe data nim and now you share insensem nim no abaka change the vaccine no ye Ghana is setting up saying expert committee W.H.O Afro once was setting up African Advisory Committee on Vaccines to check at each step no Africans, Ghanaians, and those who are going to use the vaccine, who nobody use vaccine, they've been involved. Until they know what is happening. Until there's wide acceptance of the vaccine.
Now, yeah, can that when they ever buy my shares in the age?
On America, they see and why job to my friend son at W.H.O. when you manufacture a company in a way vaccine when you what's no actually wasn't why a vaccine or manufacture vaccine. No vaccine so there you see a company in the cow. Into WHO once watch there you was na yenya sikani de kotia na mka there's an organization Gavi Alliance one usually wo chia vaccines cow ama African countries you to one cut of vaccines yenya bi extra COVID vaccine they be nankasa yenya as donation from the WHO even though Ghana government so toby into most of the children vaccines are now droban order more protect one against malaria and most of them no gabi check out na Ghana government will support ABA remuneration for the staff ABA getting the injections na I don't know no Ghana government so we check out most of the vaccine ankasa no usually WHO no will provide into other ones what they will bring a scour here to make it more sustainable and make sure that one will hear hinara one saka not there be no one saka na be no one saka
na one more obeka o musabeka no free bosume ben 8 category no him for the benya bi
so we start from 6 months 6 months in your first dose into 6 months to 6 months about first dose 7 months our second dose 9 months our third dose not 24 months into from children from that age downwards but because of the benefits no so what should be a yin kakabro 2 years no do na so what board na senya wotuma but ni na ye hihye o de hwehwem ne hwede what are the benefits because clinical trials no what year no who the them age group no benefit most from the vaccines.
I see. Eti afutu be na de magana fo nyina rehye be na de magana fo nyina from FDA anti-dilis wo say no edro ye be no say nya hotoso wo mu asem na oka from FDA's perspective. Okay.
And from FDA's perspective, Mama can't say for the FDA, no, we are your well-being is our priority. One Ghana phone, one here, most important on the idea here him pa. And you make sure that say instead of a drubia tum, you show me. Now malaria vaccine from beginning of its development, FDA, we have been involved. Here, shishum. Yako site where yako head most work clinical trials where you ya call pilot evaluations are there data no we collect no onye BB 4GB and what them but it is the right data. Into the data as are now is credible. The data also check the vaccine no obobo hen. Obobo mo from our won ho ban efi malaria. Into we kan you that say in the long run say ye tumi enya vaccines ni hina na say we roll it out. You be encourage there ibiara no aneba or qualify no for no call won ho ban because obey your the obo way under 5 when you when you gen ho obey malaria now God forbid we film wa be botum abon ho ban with the vaccine nti o mayin hina yen so na say FDA so edu bia ye beja atum no ye hwehwe ye koda ye hwehwem na continuous safety monitoring of the vaccine nti onye da ye gi tum na ye je ho ye boto aso nti at any point in time hu da se do no mbo he na ye be ka da ye use edu ni biom nti ye ka amount for the so for edu bia la e bia COVID vaccine malaria vaccine any vaccine and any edu bia or hypertensive medicine na say nsunsun so boni bia or the FDA na catch him because your experts will review the information and we share the information in now no to advise FDA there yen dey and yen dey na etum ya koda ya bo Ghana for yen ho pa nti said that so when your bibia la here doors are always open number fan and kasa
Auntie Adela Ashi, a principal regulatory officer, safety monitoring department, Food and Drugs Authority. Or no buy and channel pay watch chirimuye papa panenfantin or ya not the brofa film na hen wine the mumpa and cha ubirin kakada or fantini. I then ask a capuma name German. E can fant kasa na amfa emam chena you know you got to do this, got to do that and memupe na nyaze. It's more than 9 or normal. Nti ade select the sida na yede ebema no na yede sida so ma Emi Scientific Herbal and Alternative Medical Hospital say segment yi wo mafa ho ka Emi dia me se mekoso kanfo no abo amana mo sense wo bom ya pom dum samu gina pa me pacho se wo yare bia wo yare bia no fako Emi na lawo shafi enya kopon dum ti ho beto wo mon krobata no ga na ba bia na mo no minim ko na wo hye minim brono a wo so nukura a wo so enti me de number na ma wo frɛ hospital wo na no ma chese se ha na wo de a koye nkrobata na wo ha no eno na ben wo enti om number no aye 020 7229505 020 7229505 and after 0244 227 192 0244 227 192 and after ne kura na 0245 275 254 0245 275 254 Emi nsame kan che o say Allahu Shafi Nyankopon ani yarsafo okura ka che anti delis say echia na pa da no kura mun krofo ba ko ba wan po na ba dani oh me pese me kan ni din na ka okwa na wa che na ma me me save ni din FDA aha anti Lovelace aha it catch anti Lovelace so me chia no like anti delis say me chia na pa na me am petam na ba sra no na malaria vaccine so ma wo bi ana manyi dodo
na wenyi dodo
na spy enti e bada say ye twen ho ba ene e bedi nkomo ene LGBTQ na some de be koso akasa agi say ye nya no fuma sebre dada ansa na ye nya ne tie say parties awodo makomako nan say bill no omofo aso ba ko so ndo omfo aso bill na hu hia tie ntontwene kura e party ben ya ye bedi hu komo papa ena afa no achi bahama yar gansam sam no say the betumi sie gba ka say special prosecutor say mahama yarga ohun son ko osi nani age papa na say NPA for say yes price stabilization no levies no on petrol and diesel and LPG no o mo ye fisu for 2 months ehun hia ambassador aba anamo fa bio ye ba chief binding ebeba na fe Titus Glove and so baba na ya asanita no so ba na me eja kwabra me no matera ha ye di nkomo yentwe ho mra once again happy birthday to Colonel Kojo Damwa. Good morning. Now okay baby
my sister Penny birthday
what friend is saying
Lavana Jura Tamate SG Ghana
I see
and then a birthday one wish happy birthday
yeah I wish na ma wa nya nin enti abada se atwa ho ba ba ye be di nkomo ye kwa ba isi ai